Wake that ass up.
Early in the morning.
The Breakfast Club.
Morning, everybody. It's DJ Envy, Angela Yee, Charlamagne the Guy. We are the Breakfast Club. We got a special guest on the line this morning. We have Dr. Torian Easterling. Welcome, brother.
Thank you. Thank you for having me, DJ Envy.
Good morning. First and foremost, thank you for everything that you've been doing right now during this pandemic. I know it's a rough time for a lot of people.
Yeah, no, absolutely. We're coming out of a sobering weekend. We just hit the mark over 200,000 deaths here in the United States. And I think it's a reminder of the moment that we're in. And I think this is why I'm here. And thank you so much for allowing me to join the show this morning to talk about the importance of the flu vaccine this year. We know that this is going to be a really important year. All of the public health officials and experts are really showing how, because of the emergency and the pandemic that we're in, we really have to send out the message that it's going to be really important to get your flu vaccine this year, more than any other year that we've been through.
I've been talking to a couple of doctors, and they said that, if you take the flu vaccine, it'll help with the COVID virus because you know what you have and what you don't have. You can tell the difference between just a regular cold or the flu or what's going on with COVID. So they're saying that definitely kids and older people should definitely take this vaccine this year.
Yeah, so absolutely. Anyone over 6 months of age should take the flu vaccine. It's going to be specifically important for young kids. It's going to be specifically important for our elders, and so individuals over 65. But really, it's going to be important for anyone. But DJ MV, you just hit a really important point. The symptoms are going to be similar for both COVID as well as flu. And so it's going to be really hard to distinguish between both. I mean, you can experience fever, runny nose, shortness of breath with both COVID and flu vaccines. So it will be difficult to really discern between the two. So that's why we really want folks to just understand that prevention is really getting immunization.
How many people die from the flu every year?
So on average, New York City and across, it's about over close to 2,000 deaths a year. Where we've seen that it's been about that for the last couple of years now. So certainly, as I mentioned from the outset, to hit this mark of over 200,000 deaths related to COVID cases, I mean, this is something staggering to really witness.
What about the fact that a lot of these people that die from COVID-19, they have a lot of underlying conditions?
Yeah, absolutely. So having chronic conditions such as diabetes and hypertension, or if you're immunosuppressed, certainly you are at a higher risk of COVID-19 related symptoms. But certainly that's the same case for influenza, that you're at higher risk if you have chronic disease. So, I would add that category along with children and as well as older adults, that they really need to make sure that you're getting a flu vaccine this year.
What do you predict will be happening?
I'm sorry, I'm just curious about the nasal. How accurate is that? Because my kids, the younger ones, if I give them a shot, they're gonna hate me for a year. But the nasal can they use the nasal and is just as good as the actual shot?
Yeah, the efficacy is just as good. If you do the flu miss, or you're saying the nasal immunization for influenza is just as effective. So, it's important to do either one. Absolutely.
What are your predictions upcoming now? Because people keep saying that there's going to be a huge surge with coronavirus, and that is because of the flu, because of the weather changing, because of schools opening again. So what do you predict is about to happen?
We're certainly looking at the science. We're looking at the data. As the three of you know, New York City was the epicenter when this all kicked off in early 2020. So we continue to pay attention to the data. To folks who are saying that we're opening too fast. I mean, we've really been looking at this and being intentional throughout. Looking at restaurants. Looking at businesses across, school reopening as well, and even as we think about sort of larger workforce and other business sectors. So that's why taking the preventive steps, continuing to wear face masks, wash your hands are the messages. They're really clear. And short of anything else of having a vaccine on the market, we have to continue to take those precautions. But certainly having the flu vaccine available early this year, people getting immunized early this year, which is why I want to thank you again for having me on earlier this year, as I joined you last year in November this time, where we were really sort of sharing the same message, but we need to get the message out early.
Now, and where can people get the flu shot too, just so they know where they can go and find information?
Everywhere.
I know my dad just got it at CVS.
I see them everywhere, flu shot. And they say,
but if people are at home
and then
they want to see what's close to them and all of the information on where to get it, how much does it cost, where can they look?
Certainly. So I just want to also note, you're talking about the campaign that we just recently launched last week, really talking about how important it is to get the flu vaccine this year. And so to the question of where can you go? So we are working, really hard to work with all the different providers across the city. So we're going to have, over 1,000 different locations, not just providers. We're also having community providers also participate in this, also community pharmacies as well. So you just mentioned, CVS, Dwayne Reed / Walgreens. So many of the big chains, but also some of the independent pharmacies as well, working with them to make sure that they have vaccinators in their locations. And we're going to be also popping up at community events as well, working with community organizations to make sure this is available in our communities.
Yeah, I was going to ask.
They're talking about they're talking about a vaccine for COVID that's supposed to be available in November. Would you recommend taking the vaccine?
So I think we're going to have to pay attention absolutely to the data around the COVID vaccine. So we're certainly right now in phase 0, right? When you think about a development of a vaccine trial, because a lot of the information that's coming out, people are really trying to discern what's true, what's real. What I would say is we need to have, some serious conversations around the history of vaccination, immunization in Black and Brown communities. I brought this up last year when I joined you all, and certainly the history of medical experimentation is going to come up. And so, addressing equity issues is paramount to making sure that people understand how important it is to take a COVID vaccine, but also safety. And so we want to make sure that it's both safe, but it's also equitable. And so thinking about who is most at risk. I talked about some of the important, groups that we have to think about: healthcare workers, people with chronic disease, elderly, even Black and Brown communities, as they have bear the brunt of, the COVID pandemic. So, equitable allocation is going to have to be a part of the process of how we distribute a COVID vaccine. So certainly all of those 3 factors are going to be important: safety, equity, but also thinking about an equitable allocation.
Now, what do you think about the school systems in the New York City area? I see, like, my daughter goes to college, NYU, and a bunch of kids got COVID, and I'm seeing it increasing. So what does that mean for the school system? Will it open up this year? Because right now I know it's hybrid, it's virtually. Do you think it'll open back up, and do you think it should open back up?
So I certainly think that we are on the right track to reopen schools. We're certainly, again, paying attention to a lot of the information that's coming, looking at cases. I think that we have some really good thresholds that we can pay attention to and make sure that we are responding to, those areas where we're seeing higher transmission. Right now in New York City, we are seeing the lowest citywide community transmission ever. We're hovering about around 1%. I mean, that's really good for us. And I think that we're in a position where we can talk about school reopening and really work with our teachers and our principals and administrators to see how we can really get our children back into the school in a hybrid model, safe, and make sure that we're protecting them.
All right.
Let me ask you a question, Doc. Since a lot of people have been spending time at home, right? You think our immune systems weakened and make us more susceptible to other illnesses?
Susceptible?
What's the word, G?
Flu this fall?
What's the word, G?
Suspect.
Susceptibility.
The doc knows what I mean.
Yeah, absolutely. Yeah, the data doesn't really point to it. I think, most people have been, we've been on pause for about 3-4 months, but then we've been back into the community, engaging with one another. And I think that what we're seeing right now is that we're reopening, but I think for the most part, the data really supports that. We're really experiencing a lot of the same sort of transmissions of different viruses, bacteria. So I don't think that there's any change there.
They were also saying, due to everybody wearing a mask, they said they don't expect the flu season to be as strong as it usually is. I guess they got, pre things from some other places that they said it shouldn't be as bad because everybody has those masks on. And you think that's the new way of life for the next 10 years? People are going to have to wear masks?
Certainly right now, that's the way forward. And you get a really good point, that having some of the infectious disease control measures in place, like face coverings, such as physical distancing, is also going to support, the flu virus this year as well, and sort of transmitting it. So I think that we could certainly see that is not as bad as it has been in previous years. But I think what we're trying to say is that it's also those precautions, but also taking the flu vaccine is going to really help ensure that we don't see a high number of deaths this year.
Now, where are we at with coronavirus? Is it increasing? Is it decreasing? I read something this morning that said it's on decline pretty much throughout the country, but is that true?
Certainly, we still have some persistent areas. Across certain areas, we're certainly seeing low levels of community transmission. But then there are certain areas, across the country where we are seeing persistent community transmission that we need to be concerned around. And these concerns are certainly not as high as we saw in March and April, but certainly concerning enough that we need to pay attention to them, and we need to make sure that we're still messaging the importance of washing your hands and making sure that people are wearing their face covering, because those are the signals that can turn into the high peaks that we also saw in April, the resurgence that people have been talking about. We don't want to get there. And so how are we preventing this resurgence, and what do we need to put into place? And I think that the more that we continue to message this, we're in Zoom now, we're not in studio now. I think that these are the things that we're going to continue to have to do right now.
Gotcha.
All right.
Well, thank you for taking the time. I know you're busy.
Absolutely.
Thank you for having me. And I just want to also say, again, I think that this is going to be really important, not just for right now, but also so that we can have a safe voting season as well, because I know that's just as important as making sure that we address COVID vaccine. I know that you all have been raising the importance of voting and supporting our electoral process as well. So I thank you for all that you've done.
Well, thank you, Dr. Torian Easterling. Make sure you go out there and get your flu shot. And we appreciate you checking in.
Thank you, brother.
Thanks for having me.
All right, it's the Breakfast Club. Good morning.